Okay, time now for our weekly check-in with infectious diseases specialist, Dr. Isaac Bogoch, physician and specialist, of course, at UHN. Dr. Bogoch, good to see you on this Tuesday morning. So let's talk about this. Ontario's measles outbreak is officially over. We've talked a lot about it, though, now. But, what are the lessons learned here from the province? And do we still have vulnerabilities here in Ontario?
Yeah, obviously, this was a terrible outbreak. There were over 2,000 infections in Ontario. This is completely preventable. Huge credit to the local public health units that helped quell this. Here's the issue. Most people are immune to measles in Ontario, but there are pockets in some communities where those rates of immunity are low enough such that when measles is introduced, it's going to take off like wildfire. That's exactly what we saw in southwestern Ontario. But for those who are vaccinated for measles, the risk is negligible. And for those who were infected with measles because they were born in an era where it was rampant, their risk is also negligible. And, so, for example, the vast majority of us are not going to be impacted by this. Having said that, it's extremely important for public health to recognize where these vulnerable communities are, who are vulnerable individuals who remain non-immune, and work hard to achieve appropriate vaccination in those communities.
Speaking of vaccination, interesting development last week, U.S. President Donald Trump getting his biannual physical. And in that, he got his COVID booster shot and flu shot as well. There's, as you're well aware, a lot of mixed messaging coming from his administration about vaccines. That's kind of putting it politely. So how significant is this to you, Dr. Bogoch, that it sort of came out publicly that he got these booster shots?
Listen, he's walking the walk. This is a individual who's over the age of 65. And we know, for example, our National Advisory Committee on Immunizations, the Canadian group that provides vaccine advice, suggests that people over the age of 65 should be getting their COVID vaccination. And that's a good example. I mean, same with influenza. I mean, influenza can cause very severe infection, especially in the very young and the very old. And, everyone should be getting their influenza vaccines when they start to roll out, which in Ontario, for vulnerable groups, they start to roll out this week. And for the general public, they start to roll out October 27th, the week of October 27th. So just be aware of that. And it's important to go get your flu shots. I think it's helpful when a world leader is publicly getting those vaccines. I know we shouldn't be polarizing or politicizing public health initiatives, but it's helpful when a global leader is getting those vaccines, and it is publicly available. Perhaps people who are followers of that leader might do the same.
Okay, it's interesting stuff, and we'll get more into the Ontario flu shot rollout as it comes more available in a couple of weeks' time. That's our time for today. Dr. Bogoch, always appreciate your time. We'll see you next week. Take care.
Thank you, Nick.